to be with you as we commemorate the 2019 World Tuberculosis Day in Nigeria. As you already know, the 24th day of March of every year is set aside globally as the World TB Day. The day provides us the opportunity to raise awareness on tuberculosis, as well as reflect on the progresses made in the fight against TB. Tuberculosis is a major public health problem in Nigeria. According to the 2018 World Health Organization Global TB Report, Nigeria is ranked first in Africa and sixth globally amongst the countries with a high burden of TB. In addition to this, we are among the 30 high TB burden countries and 14 countries in the world on all the three World Health Organization lists of high burden countries for TB, and TB, MDR TB, and TB and HIV. I must point out that Nigerians, especially aged within the age of 15 to 44 years, that is the working age group, is the most affected group by TB and TB deaths. Distinguished ladies and gentlemen, let me inform you that the Federal Ministry of Health, in collaboration with our partners in the fight against TB in Nigeria, has not relented in our efforts to reduce the burden of TB. Permit me to highlight some of the significant progress, in short, that we have made so far. These include establishment of a National Domestic Resources Mobilization Committee to assist in mobilizing more resources for TB control. Secondly, the development of a public-private mix, directly observed therapy, that is DOTS plans, to support massive expansion of TB services to health private sector facilities. The expansion of diagnosis and treatment services across the whole country. Most of the items that we are involved include we're able to increase the number of health facilities providing free medical services by 30% within 1 year, from 7,389 in 2017 to 9,625 in 2018. Our target within the next few years is to scale up TB services to all health facilities within the packages for the universal health coverage. As you all know, the basic diagnosis tools for TB in the country is the gene expert machines. We are all collectively worked with the partners to increase the number of gene expert machines from 32 in 2012 to 397 in 2018. In furtherance of our commitments in engaging the private sector in TB service delivery, part of the gene expert machines procured by the Ministry of Health by the federal government was donated to us in the private sector. The other aspect is the TB microscopic centers, which we have increased from 1,148 in 2010 to 2,856 in 2018. We have also adopted newer techniques or newer tools to aid TB diagnosis in the country. The TB lab recently adopted we further enhanced TB diagnosis among the HIVs. Also, TB labs, we enhance our efforts in diagnosing TB in areas where there are challenges with electricity, as well as in areas hard to reach. We have also decentralized the PMDT services to the communities to ensure that all diagnosed drug-resistant TB cases are placed on treatment. 28 states out of the 36 states of the Federal Republic of Nigeria and the FCT have treatment centers for management of drug-resistant TB. Despite these significant achievements, much is still left to be done. Low TB finding remains our major challenge. Our national TB coverage for 2018 was only 25%. This implies that out of the estimated 418,000 new cases, only 106,533 TB cases were notified in 2018, leaving over 300,000 cases undiagnosed. Similarly, the current proportion of health facilities in the country with TB facilities is barely 26%. Let me add to the access to TB diagnosis services is also a major challenge. The current local government coverage of gene experts, which is the first-line test for diagnosis of TB, is only 41%. Another worrisome trend is that of funding. The catastrophic cost survey conducted in 2017 showed that 71% of TB patients and their households are affected negatively by the catastrophic costs due to TB. To address these challenges, our President, His Excellency President Muhammad Buhari, participated in the first ever United Nations high-level meeting on TB that was held in New York, United States, in September 2018. The President, along with other leaders, made a firm commitment towards eradicating TB in the world. Following the commitment, TB diagnosis, treatment, and prevention targets were set for countries. To further demonstrate government determination to end TB, we have developed an action plan for translating the United Nations, the UNHML commitments on TB into action. This document, with a roadmap for the implementation as well as a report of the catastrophic cost survey, will be launched here this morning. The government of Nigeria is therefore committed to enhancing available services alongside the expansion of TB diagnosis and treatment services to improve access in line with UHC agenda. Our plan going forward is to rapidly expand TB treatment and diagnosis services in both public and private health facilities by ensuring capacity development of health care workers on diagnosis and management of TB, and to strengthen interfacility linkages for TB services by ensuring that every OPD's attendees are screened for TB in all health facilities. We are also to create an increased demand for TB services through awareness campaign on TB in health facilities, schools, and communities. We also plan to ensure to improve social protection packages for TB patients and families, as well as ensure a more robust engagement of professionals and professional associations and civil societies and organizations. Distinguished ladies and gentlemen, we hope to achieve all this by improving our domestic resources for TB control. As a follow-up for our domestic resource mobilization drive, we shall leverage on the resources from the Basic Care Provision Fund, Save 1 Million Life Performance for Results Program, Primary Healthcare Revitalization Program, and ensure inclusion of TB in benefit package into the National Health Insurance Scheme. Furthermore, all the 36 state governors, the ministers of the Federal Republic, and other relevant ministries will be brought on board for this exercise. As you may be aware, the theme for this year, commemoration in its time, while the slogan is to end TB in Nigeria, keep the promise, find TB, treat it, and treat TB, sorry. The theme and the slogan of the TB Day commemoration is very apt, considering its timing in line with the theme. Several activities have been carried out, including community outreach in Kobe community in Abuja, in which the First Lady, Her Excellency Aisha Buhari, flagged off the screening and the testing of TB. The activity was also meant to create awareness on TB prevention and control.
Very quickly, what would you like to say about today's event, tuberculosis?
Yeah, I think this commemoration of the World TB Day in Nigeria, it's really great success, and it's really giving the strong message to the communities, political leaders, and the local government leaders to really do more for TB, towards ending TB.
Is it very true that it is curable?
Yes, TB is completely curable and even preventable, but we need to diagnose, treat all people with TB as soon as possible.
Could it be too late for it to be treated?
No, I think never too late. No, whoever has TB need to be access to the proper diagnosis and care. Then people can be treated.
Okay, I see. What's your name, sir?
I'm Nobu Nishikiori.
What's your designation and your organization?
I'm medical officer, Global TB Program, World Health Organization headquarters, based in Geneva.
Okay, very pleased to meet you. Now, what's your goodwill message for those that are going through pains, through TB presently, that are down with it? What is your message to them?
Yeah, I know that TB is a stigmatizing disease, and there are a lot of misconceptions and the myth in the community, and probably people suffering from TB may be suffering from additional issues related to the stigma and discrimination, but there are people around you can help you, and the health system shouldn't be based on the discrimination, providing the care free of discrimination regardless where you are and who you are. So please stick to the treatment and complete the treatment, and also join our forces to eliminate any discrimination, any form of the discrimination for TB.
Does it lead to any other disease?
Sorry?
Does it lead to any other disease?
Okay. So there are some overlapping conditions with TB, like malnutrition. If you have malnutrition, you are likely to get TB, and also TB deprive your nutrition. And also for some other conditions like diabetes or smoking, there are a lot of issues overlapping with TB. So we hope that treating TB will be the opportunity for healthier lives, healthier yourself.
Thank you very much. Is there any age bracket? Does it affect children?
Yes, I mean, in children also affected, and in TB, if the TB is abundant, like a country in Nigeria, a lot of children also suffer, but also the most productive age of the population, like 20s, 30s, 40s, those are most affected in a country like Nigeria.
Thank you very much. What other thing do you want to say? What other thing about this program you have?
So TB is not only medical condition, right? TB is a social disease. So we need to work together. All segments of the society, all people need to work together to end TB.
Launched this book, the National Tuberculosis and Leprosy Control Program, to save Nigerians and protect us from the surge of TB. We hope with this, TB will be eradicated in Nigeria in Jesus' name.
Thank you.